The 2025 session of the Texas Legislature proved that Texas hospitals can advocate for their survival and success under any conditions, and turn that advocacy into results. Once the legislature adjourned its regular session on June 2nd, THA and its members had plenty to celebrate, including legislation boosting behavioral health in rural hospitals, a comprehensive and life-saving clarification to the exception to Texas's abortion ban, funding wins in the state budget, and much more.
What we have that others maybe don't always have is the army of hospital government relations folks who are ready and willing and able to step in and help out and mobilize in a way that I don't always see from other groups. And so that makes us rather unstoppable when everybody's working together.
THA's attention had to be unusually divided during this year's session, with Congress considering deep cuts to Medicaid as part of a major budget reconciliation bill at the same time state lawmakers were meeting in Austin. Providing another backdrop to this year's session was the measles outbreak in West Texas, which resulted in hundreds of cases and illustrated the need for strong vaccine uptake. Meanwhile, at the state capitol, hospitals faced another thorn bouquet of potentially damaging bills. But THA, entering this session with new leadership and new faces on its lobby team, helped make sure the worst of these bills didn't become law.
With the help of our hospital advocacy group, certainly the GR members of our hospitals were able to sort of attack the Capitol and really remind legislators and staff of the importance of hospitals, the community benefit they provide, how they are a large employer.
For hospitals, few if any bills that became law were as impactful as the Life of the Mother Act. Strongly and vocally supported by THA and the Texas Medical Association, the Life of the Mother Act added vital clarifications to the medical emergency exception to Texas's abortion law. Doctors who encounter a life-threatening emergency for the mother during a pregnancy now have the guidance and state law they need to legally terminate a pregnancy to save the mother's life. Other key legislation supported by THA included an expansion of provider eligibility for the loan repayment program for mental health professionals, which incentivizes practicing in mental health professional shortage areas, major funding and support for rural hospitals through legislation that introduced several new programs and initiatives, including a Rural Hospital Stabilization Grant Program, and wins for hospital workplace safety and security, including a measure requiring notification to hospitals before a visit from a violent criminal on parole who is wearing an electronic monitoring device. Lawmakers also maintained important existing funding levels in the state's next 2-year budget and provided new funding in key areas, such as $31 million in new money for rural inpatient and outpatient hospital payments and Medicaid, and a $156 million increase in funding for mental health community hospitals and community inpatient psychiatric beds. Bad policy pursuits that THA successfully stopped included one bill to implement a bounty-type system targeting hospitals for health insurance fraud claims, anti-vaccine legislation that would have granted providers the ability to opt out of any immunization for reasons of conscience, and several pieces of legislation to restrict hospital facility fees. THA's productive discussions with the authors of one key facility fee bill helped blunt its potential impact before the bill fell short of passage. Ultimately, a turbulent session that could have blown Texas healthcare off its foundation instead left THA and its members with heartening victories, crises averted, and new resolve.
We know we still have challenges, particularly with the health plans and their affiliated entities and the messaging that they're doing, but those are things I think that we can work on during the interim.
For a full recap of the 2025 session and its impact on Texas hospitals, download THA's end of session report on tha.org.